the CDC does say that when two people are wearing masks, that significantly decreases the risk of spread for COVID. So it is my opinion, interpreting that data, to consider either requiring or urging masks or face coverings for customers and to have a small supply available. And this will really help to decrease the transmission in where physical distancing is difficult to maintain. So not only do I think that there's good evidence that the CDC is recommending wearing face coverings and masks for your employees, but also considering requiring your customers who are coming into the store. So the next thing I'm going to talk about is testing. And I know that there's probably going to be a lot of questions about that, but so the recommended test for current active infection is the viral test, which is nucleic acid or antigen. So that's different than the antibody test, which I'll get to in a minute. So I'll use the viral test, which we typically think of as the nasopharyngeal swab, or there's the mid-turbinate swab. There's also the anterior swab, which is just kind of the inside of your nostrils to test that. That's currently what the CDC states are some options for active testing. On the side note, there's some saliva studies that are going on, but it's still in research process. So it is, my opinion, I do think that the nasopharyngeal or oropharyngeal swab, it is deeper. It has very good evidence. It's kind of the standard that we're holding. The only thing better than that is a hospital procedure that's a lavage of the lungs itself. My only concerns with the anterior, like just in the tip of the nose test, would be that it does require 10 to 15 seconds of swabbing for that to be done. And so I think that because of that, it has some limitations, although we'll see. So all of those are available, readily available in Chattanooga, which is great. So at this point in time, so at this point in time, the antibody test is not recommended for diagnosing active infection, and its clinical significance for the general population is not yet determined. Therefore, although the White House put out some guidelines for how to understand and interpret the active infection, which is the viral test, compared with the antibody test, I definitely do not think that anybody is recommending using the antibody test in a determination to determine when people should or can be released from isolation or quarantine and return back to work. Maybe that will change over time, but I don't see any reason for in the business side of things to require having an antibody test, because its clinical significance is still limited in that area, although there are some applications in the hospital setting where it is necessary as we're going through treating somebody that we might need to know if they had that due to some complications. All right, next slide. So yeah, the White House, you can see if you just have some questions kind of for your own information, this is the data that we have thus far. But again, I do not think that the antibody test should be used to determine if someone is safe to be released to go back to work. Next. Okay, so employees who either have symptoms of COVID-19 or test confirmed COVID-19 should stay home and isolate for 10 days from the onset of their symptoms, or if they were asymptomatic from the date of their test, before being allowed to return back to work. As long, and again, this is the CDC, this is the symptom-based testing, the symptom-based strategy for when to discontinue isolation. So either they have symptoms, which you can find all the symptoms, I'm not gonna go over that again. Either they have symptoms consistent with COVID, and you start on that day one and count 10 days, or the date of their test if they were asymptomatic. If the last 72 hours prior to those 10 days being up, they need to have been without a fever, without the use of Tylenol or ibuprofen, and they need to at least be improving. So they can still have a cough, they could still have some minor headaches and minor symptoms, but as long as they're not worsening, that would be when to discontinue the isolation or quarantine for someone who is using the symptom-based test. And that they would be able to return back to work, and the recommendation would be to use a face covering or a mask for the next 14 days. The alternative that is also out there that the CDC talks about is the test-based strategy. So the test-based strategy is one that gets the test, and when there's a positive test, then it states that before discontinuing isolation, not only do all those previous parameters need to be met and that the patient should be improving clinically, but also that they would need to have 2 negative tests, not antibody tests, 2 of the negative active tests at least 24 hours apart in order to be released from isolation. The concern with that, the concern that I have with that, the concern that a lot of people have with that is that a lot of the data that we have right now from the CDC says that people can shed this virus can have this virus still be detected for sometimes 8 up to 12 weeks after the active infection. So that's kind of a weird thing to think about. But the person is like, there has to be a certain threshold of the virus that it might be in your system, but it's below a threshold to where it would be considered contagious to other people. So there's a lot of information, and I gave you guys access to it, but it is about all the information that the CDC has thus far is that after 10 days, live virus cannot be cultured to be like replicated and to infect other people after 10 days from when the symptoms started. So a test could still be positive just because the test is really that good at detecting very, very small amounts of the virus. But with the information that we have available at this time, we have a lot of reason to think that even though it could still be detected, if it's past those 10 days and the patient is clinically improving at this point, it is reasonable to think that it's no longer contagious. So I know that's hard and it's confusing, but I'll get to why I think that that's important. So the CDC does offer that there are 2 strategies. There's the symptom-based strategy and there's the testing-based strategy. Again, they talk about the symptom-based strategy, especially in a lot of places where testing is not available or it's not widespread available. So I do think it's important that they give that symptom-based strategy in those 10 days. The testing-based strategy, you'll see they talk about how it's important to understand that if repeat testing is even feasible, that there are reasons to consider that. But the CDC recognizes that there may be circumstances where an employer may choose to use the test-based strategy requiring 2 negative tests 24 hours apart. But it says that entities enacting such policies should do so explicitly, with clear justification and in coordination with local public health authorities. Therefore, it is my opinion that if an employer is going to choose to use the test-based strategy and require employees to have 2 negative tests before being allowed to return back to work, that they would do so in coordination with the health department and reach out to Dr. Paul Hendricks, and his email would be available to talk about why that employer has deemed that strategy is necessary for their workplace compared with the 10-day strategy. I know that was a lot. It's one thing I'm pretty passionate about, though, because I've definitely had people who are looking at, it's not till they're 5 or 6 weeks out that they finally get a negative test and can finally go back to work. So that's definitely a policy. If your business has enacted they must have 2 negative tests, really please consider the potential harm that is coming out of that, and that the symptom-based strategy is a reasonable alternative as well. All right, moving on. So if you are someone who has been in close contact with a positive case, or if your employee has, that is either in the same household as someone with confirmed or suspected COVID, or had close contact, which is defined as less than 6 feet away for more than 15 minutes. Now, they don't state whether or not if both people were wearing masks. I can't find if that's what they mean. But again, when both parties are wearing masks, we know that significantly decreases the risk of transmission. If that is the case, those people who live in the same household or who have had significant close contact with someone who's known to be positive should should quarantine themselves for 14 days in order to monitor themselves for symptoms. If they can get tested, I would recommend that. If it comes back negative, because they might just be too early in the disease, it is reasonable to get retested after at least 5 days to see if their test turns positive. Again, I do think it's important to recognize that the Families First Coronavirus Response Act recommends not only paying employees who have COVID while they're out on quarantine, but also employees and workers who are either caring for someone who is sick with COVID or someone who is in isolation or in quarantine because they've been exposed to someone. So please take a look at that. I know it's every business is different with the finances, but take a look at the Families First Coronavirus Response Act. Take a look at what your responsibilities are. Understand that if you're using the short-term disability, to have the kind of put the onus on the employer and the employee and the worker to get that. Again, if they're not, those are difficult systems to navigate, especially if English is not their first language. Again, there's a lot of confusion with my patients. They just don't know what to expect. So making it clear what they can expect about if they're getting paid, for how long they're getting paid, if they're getting paid for a certain amount of time, and after that they're not getting paid, please take a look at that and consider there's just a lot of unknowns and fear that comes with the unknown for my patients. I already talked about number 8, and I already talked about number 9, basically, is that understanding that a single negative test does not mean that a person could not develop COVID or test positive the next day, week, or month. And so if there's a known re-exposure or new symptoms develop, please consider getting retested. So that's the bulk of what I had to say. The next slide just kind of says, while we recognize that employers have a responsibility to their employees, we also do think, and that slide should say employees should also, this slide should say employees, but employees and workers do have a responsibility to inform their employer when they're feeling sick, to stay home when they're not feeling well, again, to participate in all these things of washing their hands, using their mask or face covering, not only at work, but also out in public, practicing safe physical distancing at work and at public, abiding by their employer guidelines. And again, that reemphasizing that a single negative test does not mean that it could not turn positive in the next day, the next week, the next month. So I think that's most of what I had to say, and lots and lots of resources.
All right, thank you so much. That was really great. A couple of follow-up questions, and just remember, everyone, if you have questions for Dr. Meador, please drop those in the chat and we will address those. So you definitely talked about this first follow-up question about requiring negative tests before employees come back to work. But what would you say to an employer who may want to require antibody tests before they come back to work?
I don't think that there's any place in the CDC that recommends that. And it actually, let me see if I have this. Okay, so on the CDC under, it is guidance business response. Let me see. It's interim guidance for businesses and employers responding to coronavirus disease. It's kind of a big general, like for all businesses. And it specifically states that employers should not require a COVID-19 test result or a healthcare provider's note for employees who are sick to validate their illness, to qualify for sick leave, or to return to work. So although it does go on to say that under the Americans with Disability Act, employers are permitted to require a doctor's note to verify that they're healthy and able to return back to work, the CDC at this time, the recommendations state that a lot of doctors' offices are currently either closed or having limited visits due to the outbreak. So I would say that I don't see any recommendations from the CDC that support employers requiring antibody tests to be able to return back to work. And actually, there's nothing on the CDC that I can see that is requiring even a baseline negative active test. I do think that that is not unreasonable. Personally, I think that that is not unreasonable. And there are places that in the CDC website, it states that consider especially if you have people who are at higher risk of contracting the disease, consider getting a baseline, or these critical infrastructure job. Consider getting a baseline test. Again, all of this is if it's available in your community.
Sure. That's great. So what, you sort of touched on this too, but how can employers better empower their employees to stay safe at work? And then also what advice would you give employers to recommend and encourage their employees to stay safe outside of work as they're in the community?
I wish I had a way to enforce everybody to do what I think ought to be done. And that's part of why I said that if you, as an employer, if you want to demonstrate your commitment to safe practices at work, and you are a store that has people from the outside coming in, maybe consider following in the steps of some companies that are already saying, hey, you've got to have a face covering. Even if it means like you got to pull your shirt up over or use a coat to cover, but emphasizing, look, we believe this so seriously. We want everybody to have a face covering. I don't think that there's any way that employers can mandate what people do outside of their work, but they can do everything in their power to set up all of their protocol and rearrange things. And there's plenty of guidance on the CDC for how to help decrease the risk of transmission, but you can show that you're taking it seriously, that you want to protect your workers, you want to protect anyone who's coming in, and setting that up as, like, this is what we're doing here. We believe in this. Therefore, we want to encourage you to do the same and normalize it. Normalize hand washing, normalize wearing masks going out in public. And I think making sure that there's consistent messaging that this is the current recommendation. Things might change. 5 months ago, nobody was recommending wearing a mask, but things have changed because of now. So I think that being aware that when we get new information, these things might change. This is what the current recommendations are, and making sure that message is clear from the top down.
Yeah. So hopefully this is not, hopefully no one has to worry about this, but if there are employees who do feel like they may be working in conditions that they're not comfortable with, how do you think that employees should be advocating to employers about, having a healthy and safe work environment?
I did not investigate that answer. I think that's a great question.
Okay.
I think that I might have to defer to if someone else has an idea. My mind goes to like the occupational safety and health, like OSHA, and seeing if you are working in a place that you don't think is safe, you are protected to go to Tennessee's OSHA in order to say, hey, I don't feel safe at my workplace. I would recommend probably first going in the proper order at your own company, but it's within your rights to say, to go to OSHA and the Tennessee OSHA if you feel that that's not being safe. If someone else has any other more direct answers, I'm happy to say that I don't have all the answers to that one.
Sure. No, I think your answer is, I think it's great. I mean, I think there's processes set in place for that with OSHA, obviously. And Jermaine may want to add something to that. But the last question that I have before we go to attendee questions, do you recommend employees wear face masks on construction sites? And if not, what do you recommend to keep these employees safe?
Yeah, so there is this, like I said, there's a specific CDC site for construction workers, what construction workers need to know about COVID-19. So you can Google that and find that. So it does recommend just in general to wear face coverings in public settings. And so it doesn't specifically state, from what I can see, that like you must wear every time that you're working. But and I know it's hard in terms of the masks get hot and your face is sweating. There's a lot of things with construction anyway that requires wearing the N95 masks because there's a lot of dust or things like that. And so I think that as much as is feasible, I think that having a face covering would be something to be encouraged. Now, if we have to balance that with safety. So let's say you've got like roofers, you've got people doing things where if that mask is inhibiting the ability to communicate and you're up on a roof trying to like get things done and you're clearly 6 feet apart and you're outside, I think those are times when you have to consider, okay, we need to balance safety so that nobody gets harmed, like falling or hurt on the job, balancing that with as much as able while you're on the ground and you're prepping things, try to wear a mask.
Sure. Yeah. So we do have some questions in the chat. So I'm going to hand it over to Jermaine to get some of those questions answered.
Yeah, let's see here. So we've got a few, and so let me go to the first one. Okay, so it looks like the first question is from Elaine Duke. Dr. Meador, should we exclude employees who have only one of the COVID-19 symptoms, even if they can verify they have allergies, asthma, or chronic gastrointestinal issues?
I think that's a reasonable question. I would say, again, I'm going with my opinion here. If someone, and again, we're in Chattanooga, it's hard because it's definitely allergy season. I know that a physician just recently, maybe it was just in Spanish, I don't remember, but she was at the allergy clinic and gave a little quick video about what's the difference between symptoms of allergies, what's the difference between COVID. So things that we see with allergies, again, it sounds like that's not really a question, but looking at allergies and asthma, I think that when there's questions like that, it would make sense to talk with their healthcare provider, maybe try to do a telemedicine visit. If there's confusion, I think it would make sense to consider asking before just making that person be isolated for 14 days. You don't already have like a system in place. I would encourage stating, well, maybe talk with either your healthcare provider or before automatically excluding, especially when there's history of pre-existing symptoms.
Okay, good deal. Let's see here. Dr. Meador, our next question comes from Sarah Hooper. And the question is, are plastic face shields as effective as cloth face masks?
So I haven't seen anywhere in scouring the CDC site that talks about using face shields in the public. We use face shields like when we're collecting because there's just so much risk of like getting coughed on and stuff like that. So I don't have an answer to that, but I think although it's like seems more comfortable just to wear this, face shield rather than a mask. And I know that one of the next questions was, what if somebody is claustrophobic and they don't like want to wear a mask? I think that there are a lot of masks out there now, like a lot of there are masks that are being produced by all sorts of people. And so before switching to something that is not necessarily, that is outside of what the recommendations are, I would say maybe work harder, maybe try some more options of the different kinds of masks to see something that would help people feel more comfortable. They're even making masks that have like a little clear plastic for people who are hearing impaired. So there's all kinds of masks out there. Again, I understand it's hot. I don't know that we have enough data to say that a face shield is as effective as a mask, because if you're wearing that face shield and you cough or sneeze, it still can go out into the air. So
yeah, okay. All right.
Stay tuned though, because maybe that'll change. Maybe we'll get more information in the future.
All right, sounds good. Let's see here. Our next question is from Mr. Mike Anthony. Are there any common myths about COVID-19 that you would like to dispel, Doctor?
Common myths? I mean, I think hopefully everyone knows by now that you can get it and pass it along even if you don't have any symptoms. and that you can have the disease and pass it to other people even before you start to develop symptoms. So that's something that I know sometimes is a little hard to wrap our mind around. So that's where the CDC talks about if you had exposure to someone who tested positive, even if it was in the 48 hours before either they developed symptoms or tested positive, to consider, if you were in close contact or you live with that person, to consider counting that as someone who's been exposed.
Gotcha.
If anyone has any other specific myths, I'd be happy to answer more specific questions.
Yeah, so next question is from Daniel Rubino. It's, do you recommend checking temperatures, and what temperature is considered too high?
So again, I don't see that specifics laid out on the CDC guidelines. They say consider doing temperature checks. If you're going to do temperature checks, make sure that it is done in a way that does not violate your workers' privacy, in a way that they can, you're not like putting a stigma on someone, in a way that it's private, but also recognizing they did state that if you're going to be recording people's stuff, that might fall into data that you have to hold on to for 30 years or something. So just being thoughtful about, if you're going to be collecting data on your employees, consider what the ramifications might mean. The classic temperature is 100.4. So I would use that as the threshold. I haven't seen anything else stating that a lower threshold would be recommended.
Yeah. And then it looks like you already sort of addressed the question about claustrophobia. And then I think the last question maybe that we have from Melissa, unless we get another question, is what if you have a child with autism and or other behavioral health issues and the child refuses to wear a mask? What do you recommend to help the child or parent to make sure the family stays safe during the pandemic?
Yeah, that's a great question. That is a great question. Again, masks are not recommended for children less than age 2. So please don't put a mask on your child who's less than age 2. So again, we have to look at we have to interpret the data and look at how it could have negative ramifications and how we interpret things. So I do think that kiddos with autism or other behavioral health issues, maybe keep trying different types of masks, seeing if there's a different one, because if it's a texture issue, but I'd say you have to do what's best for your family as well. And if it's an issue of the child won't be allowed into childcare setting, or they won't be allowed into school, those are difficult things. And so I personally am not going to recommend forcing a mask on somebody who has autism or who cannot understand the reason for doing that and is having difficulties. I do want to encourage continued being open to trying new things and being open, maybe not now, but maybe they can work on it and not just giving it up forever. Maybe if a daycare or school is requiring masks, I would definitely go to your healthcare provider to talk about, if your child cannot do this, advocating on their behalf.
Yeah, and just as a follow-up to the question about the temperatures, the state of Tennessee, the governor's office, and the Tennessee Pledge guidelines does recommend as a best practice for employers to take temperatures on site with a no-touch thermometer each day upon an employee's arrival to work. So just for our businesses to know. And the normal temperature should not exceed 100.4 degrees Fahrenheit, which is what you said, Dr. Meador. Let's see here. It looks like we may have another question that came in. Do you have any comments on the interaction between hydration and the coagulation effects of COVID-19 in the blood of those infected? What is the best policy on hydration?
I'd say stay hydrated. I know it's hard. I know it's very hard, but it's also very important. So I don't have any comments specifically on the coagulopathies that can be seen with COVID-19. But it's summertime, it's hot, we all need to stay regularly hydrated. So I don't have a specific solution, because everybody's environment is going to be a little bit different, but I do think that's important to recognize. Maintaining hydration is vitally important during this time.
Okay. So Dr. Meador, if you don't mind, for those of us who are not medical professionals, if you could translate that question to the rest of us a little bit about what exactly is coagulation effects, what does that mean?
Well, I'm not sure that, so coagulation has to do with how the blood clots. I don't understand necessarily the question because I don't think that there's any evidence that dehydration increases the risk of coagulopathy. So, but I haven't investigated that, so that's why I didn't want to comment specifically on it. But so blood clots. So like if you get a blood clot in your leg, or that could then move to your lungs, called a pulmonary embolism. That's something that can happen with coagulation effects. I don't know of any relationship between dehydration increasing your risk of that, but stay hydrated was my main message. So that's why, yeah, I'm not quite sure exactly the question, but stay hydrated.
Gotcha. Dr. Meador, is a person with asthma considered an at-risk individual?
Ooh, I did not foresee that question coming. From what I've been reading, I'm going to go with I don't know. I'm going to go with I don't know. But we have not worldwide necessarily seen, like, we know people who are at high risk, like patients who are older, patients who have diabetes, those are definitely risk factors. As far as I know, at this point in time, asthma has not been identified as a particular risk factor that significantly increases the complications from COVID. But that could change as we get more information. And so I'd say if you have any kind of underlying medical problem, just being aware about that, being smart about that. But I haven't seen any direct correlation between asthma specifically increasing the risk of the severity of COVID-19. That could change.
Gotcha. And it looks like we've got some additional chat that's sort of going on here among some of the folks about asthma. Let's see here. Now, it does say, according to the coronavirus.gov website, which is the CDC website, that people of all ages, and I'll put this link in the chat for everybody to see, but it reads, people of all ages with underlying medical conditions, particularly if not well controlled, including people with chronic lung disease or moderate to severe asthma. And then it also lists people who have serious heart conditions, people who are immunocompromised for a variety of reasons, and then people with severe obesity, diabetes, chronic kidney disease, or liver disease. Let me add that link here in the chat.
Yeah, I don't disagree. I don't disagree with those. Yes, I think that I agree with with those risk factors.
Let's see here. It looks like we got another question from Harolda. I've heard mixed information about the likelihood of being able to contract COVID-19 from hard surfaces. What recommendations do you have for how employers and employees should deal with commonly touched surfaces like copy machines, items in break rooms? I guess that would also include door handles, Dr. Meador, even potentially the pump at the gas station, which of course is not in the workplace, but is a commonly touched surface.
So at this point in time, again, based on the CDC recommendations, they do recommend wiping down regularly. So I think that I would be, even if things are changing in terms of like maybe it's not spreading as much, because I have heard that as well, I don't foresee any recommendations changing the frequency of which we recommend wiping down common surfaces. So, yeah, so I say stay tuned, but as of my reading of the CDC website within the last couple of days, they haven't changed their recommendations to do frequent wiping down of surfaces.
Okay. All right, good deal. So I think we may have about 2 more questions, and then Dr. Meador, we'll let you off the hook. Let's see here. Any comments on whether the amount of airflow or ventilation inside buildings can help to reduce the risk of COVID transmission in the air?
I don't have any comments on that. I do think there's probably a lot of resources available on the CDC website to be able to talk more about airflow and ventilation. So again, their site is just packed full of drop down and after drop down after drop down. And so it might be within the, there are just so many options to look at this, but there is a cleaning and disinfecting, disinfecting your facility, reopening buildings after shutdown. That might be something to take a look at. So there's lots of links. I don't have any comments specifically on that one.
Okay, and then you may not be able to answer this one either, doctor, but
I don't think so. The UV lighting one?
Yeah, that one. Yeah.
I can't comment on that just because I don't have enough information. I haven't. I do think that it was discussed at some point on that cleaning and disinfecting, but I don't think that it definitely was not like highlighted as using the UV compared with EPA approved disinfectants.
Sure.
So I'd say, again, stay tuned to more information, and maybe there are additional, maybe I just haven't seen that specifically with the UV lighting. So I'd say definitely like look into it, look at the potential harms versus the potential benefits.
Yeah, yeah. And then you may not be able to answer this question. We know you're a doctor, not a lawyer. But it says, when it comes to sharing health information with employees and families at our child care center, what does the law say about COVID-19?
I didn't, let me see. I don't have the answer to that. Let me take a look again at so there is specifically a child care, schools and child care drop down on the CDC. So that would be something that I would look into and see where if they have more data on that, because or more specific guidelines for what you can and cannot do. So I'd say that take a look and see what the CDC says. But again, like I said, specifically for businesses, it had said that although employers are permitted to require certain things, they quote, employers should not require a COVID-19 test result or a healthcare provider's note for employees who are sick to validate their illness, qualify for sick leave, or to return to work. So I think that that's something that you'll have to kind of take a look at. I think there were just a couple more things that I wanted to mention. I think I spoke significantly on the persistently positive tests and how those tests can remain positive for a long time. Looking at critical infrastructure jobs, that's one thing specifically that the CDC states employers in critical infrastructure also have an obligation to manage potentially exposed workers' return to work in ways that best protect the health of those workers, their coworkers, and the general public. So that is one thing where discontinuation of isolation for persons with COVID-19 who work within the critical infrastructure, they may either follow either the symptom-based strategy or the test-based strategy in consultation with a healthcare provider. So, and then even more so in patients, in workers who work in a high density critical infrastructure workplace after a COVID-19 case is identified, that has even more specific guidelines that are talking about, there's like a whole algorithm and this diagram that talks about the testing strategy. So if you have these critical infrastructure workers that work in high density, it goes through these different tiers of like tier 1, tier 2, tier 3 of their level of contact. And then it gives you some different options in terms of if you're going to require testing, if you're going to require quarantine for which one of those. So I would definitely recommend following that. So again, the high density critical infrastructure workers after COVID-19 cases identified. And then finally, what I wanted to say was that restaurant employers fall within the definition of critical infrastructure workers, and especially those who offer carry-out options. So therefore, this is my opinion, restaurant employers have an option with how to handle persons who have had close contact with someone who has confirmed or suspected COVID-19. As a critical infrastructure worker, they may consider allowing the worker to continue working while monitoring symptoms and practicing appropriate measures such as wearing the mask, maintaining 6 feet away, hand hygiene. Alternatively, restaurant employers may also choose to have workers who have been in close contact to quarantine for 14 days. From what I can tell and researching based on the CDC's current guidelines as of last night, Either strategy has data and decision is supported by the CDC, and the decision should be made within the context of the local burden of disease and in coordination and collaboration with public health officials.
All right, very good, very good. Let's see here. Thank you so much, Dr. Meador, for doing this today. We really appreciate it. Lots of great information that you were able to provide. We are going to make sure that we send out the questions and some follow-up information in our follow-up email after the webinar today. I want to thank everyone for hopping on the webinar this afternoon. We really appreciate you joining to learn more about workplace testing. Again, thank you to Dr. Tiffany Meador for presenting today. So thank you, Dr. Meador. You did a great job.
Pleasure.
I know there's a lot of information, and again, there are lots of online resources that can help you as you structure your workplace, including all the stuff that's come from the governor's office on tnpledge.com, as well as coronavirus.gov, which is the CDC website. We hope everyone learned something that you can apply to your own workplaces. And I also want to especially thank Brooke Satterfield for a wonderful job producing and moderating today's webinar. None of these webinars would happen without Brooke's hard work. So thank you, Brooke. As we close, we just want to make sure that everyone has contact information for Bonnie Deacons over at the Hamilton County Health Department. Ms. Deacons is over environmental health, so if you have questions that are specific to your workplace or your industry, please reach out to the Hamilton County Health Department and direct those questions to Ms. Deacons. Also, as we send out the follow-up email, we'll also be sure to include contact information for OSHA in case you are someone that has a concern about your workplace and you feel like you need to report that concern. We'll make sure that we provide that information to you as well. Again, we've got information about the previous webinars that we've done at cha.city/COVID-reopen. And then we've also got, and then as I said earlier, you can also learn a lot from coronavirus.gov, as well as the information from the state of Tennessee made possible through the governor at tnpledge.com, which is the Tennessee Pledge Guidelines. So I just want to thank everyone once again for joining us this afternoon. I especially want to thank Dr. Meador and Brooke for doing a great job today. And we hope that everyone has a wonderful and safe afternoon and a good rest of your week. Happy Father's Day to the fathers on the call. And please wear a mask.
Yes.
Everybody have a good day.